Esperanza Health Center is located in Philadelphia.
So we are a federally qualified health center, which means we work and serve primarily in a particular community that is underserved and under-resourced in terms of the healthcare needs that are here. Our particular health center started off with the vision really of working within the Latino community because there were some big gaps in the quality and access to healthcare that we saw here about 30 years ago. And so we were established to kind of fill those gaps, to provide quality healthcare and give people the opportunity to engage with a doctor who could speak their own language. That's how we started. It's evolved a bit as our community has changed over time, but we are faith-based and are committed to that at our core.
Esperanza offers all kinds of health services to their patients. They currently have 3 locations, one in Hunting Park, Kensington, and 6th Street. The communities around these centers have been struggling with poverty for years.
I mean, I think this community has struggled for a while economically. These are not new challenges for this community, and yet, so I think when Obamacare started being rolled out, it was exciting to be able to have new ways to connect with folks in our community to help try to enroll people into care. And though those are some of those things we've always done, we've always served the uninsured and those who are underinsured. Having new opportunities and resources through the federal government available to our community has been really helpful, because I think we, again, have been able to advocate and try to connect those who most need these resources to these resources because we have established relationships. I think now with a lot of the uncertainty in the political climate and kind of what's going to happen with healthcare, it's not exactly new to us. I mean, we've kind of been through other hurdles like that before, but you definitely see the stress on people. I think for us, what we're feeling more in our community is even thinking about what's happened with the hurricane and how will individuals who've been affected in Puerto Rico, as they're arriving here without the proper documentation or what is typically required, how will they have access to services? We're kind of wrestling with that as an organization, trying to figure out if these folks don't fit sort of the requirements of how we typically operate, what do we do? And there's tons of uncertainty, obviously, with the political climate and what might happen with that. But our commitment is, again, to filling the gaps where we can, both through federal funding, but then also doing our best to find other resources, foundations, private donations, church donations, and really trying to rally others who would partner with us because of the mission of caring for those who need access.
Other than health services, Esperanza offers their own Youth Fit Kick program, other fitness programs, cooking classes, as well as a health promotions program for their patients. Esperanza also offers affordable meal options in the Esperanza Cafe, where Sonia Ferraro works. Sonia is also a patient and receives medical care at Esperanza.
I work in the cafe. I am in charge of the shopping. I go Mondays and Wednesday, and I really like it. It's a men's job, but I can do it. I am very happy and flattered to be part of the team of the cafe and to be part of Esperanza Health Center. I am also a patient here. After I leave my children in school, I fly here, begin to work. Then I finish working, I fly back to school, and I bring them to martial arts. This is the best place to be.